Such an honor to be here, and thank you all for sticking around to listen to this talk. I wanted to ask you all a question. How many of you think you get enough fiber in your diet on a daily basis? Maybe raise your hand. So we've got sounds like 50% there. But have you heard of the fiber gap? Anybody? You might have heard me talk about it previously. You have there. Yeah. So in the U.S., people were surveyed and asked, do you get enough fiber? And 67% of the U.S. population said, I get enough fiber in my diet, and that's what they thought. But in reality, how many do you think actually got enough fiber? 10 is too generous. It's 5, less than 5, actually. So just the next 30 minutes, I'm going to talk about how fiber is your friend and why it is your friend and how you can think about it and where to get enough of it in your diet. So we'll talk about diet, we'll talk about the microbiome, the research we're doing in that, and then some practical tips to wrap it up. I want to make a disclaimer in the beginning that, of course, when we're talking about this, it is a generalization of what we're talking about, and you need to individualize it to yourself. You have to think about whether you're diagnosed, newly diagnosed, relapsed, whether this is right for you at this time, whether you feel receptive to hearing about it or it's too much, and whether it empowers you or overwhelms you. Of course, these issues are important, but there are right times for them, and you can decide for yourself. I also think some people like to make changes overnight, and they say okay, I'm going to cut out these things, I'm going to make changes overnight. And other people might want to do this gradually and say, I'm making one change at a time so it's not overwhelming. So think about what floats your boat, pretty much. So nutrition research, I think, is a really unmet need for patients, and part of it is I had Hodgkin's lymphoma about 8 years ago, and when I went through that experience while I was a fellow, I realized I got no training in medical school, in residency or fellowship around this topic, and I realized I have family members, friends trying to tell me, oh, eat this, do that, and then I realized this is something that's very important, and we need to bring more evidence into this area and talk about it more for patients. So that's what I decided to focus on in my career as a faculty. So what is a balanced diet and who follows this? And the reason I recently started talking about this is because I sometimes get pushback, and people say, you shouldn't be telling patients what to eat. Cancer patients are already going through enough. Just tell them eat a balanced diet. And my answer to you is, how many people here know what a balanced diet is? So, and that's the thing which even I think many physicians are not aware. So when we say eat a balanced diet, what does that really mean, and how do we even follow it? So if we think about the US population, how many of the US population are even following a balanced diet? So these are the USDA guidelines. Some of them, of course, there are more, but I'm just focusing on these. Fruit intake, vegetable intake, fiber, and then the healthy eating index, meaning a score of, ideal score is 100, but what is the US population's general scores? And this is basically the US population. Fruit intake, only 12% meet it, vegetables 10%, fiber less than 5%, and these guidelines less than 20% meet them. So when we do say, and getting a score of 59 out of 100 on a healthy eating index is like a fail. So it's a low score. That's the average for the US diet. So this is just the USDA guidelines. We're not talking about any specific diet, any special diet. We're just talking about the USDA guidelines here, and very few people even follow those. So when we say balanced diet, I think it just confuses everybody. It's what does that mean? And so I think you can go to look at some of these things, but we'll talk a little more about why it's important. Another thing people will say is we don't have enough evidence that diet affects cancer directly, but we have enough evidence that it affects cancer indirectly, and that's what I want to show you here. So this is a patient who I treated some years ago, and you can see the number of medical problems in addition to myeloma that they had. And so because of this, it makes it harder for us to take care of the patient, and For that reason, the patient was not a candidate for stem cell transplantation, CAR T-cell therapy, clinical trials, and even some intensive chemotherapy. And because of that, they had a decreased overall survival. What I've highlighted in green are things that I believe could have been avoided over a lifetime with diet and lifestyle changes over time. Of course, you may argue some of the things you may not agree with, but it is potentially possible. So I think that whether directly or indirectly it affects it, this is something we want to think about. How do we optimize ourselves to be able to handle all the treatments that we want to go through in the best possible shape? Now moving to some of the studies that have been done around diet and cancer, and the thing is that dietary research is hard, partly because it's not like a drug. You either take it or you don't take it. It's subjective, right? Like some people might follow it 50%, some might follow it 100%. And looking at populations, that's one good way to study it in terms of understanding. But the problem with that is you can have interactions where somebody may have also be walking and physical activity. So is it really the diet, or is it because of their lifestyle for other things? So there are these issues that come up, but most studies try to adjust for these issues when they do the analysis. You can see 3 studies from different countries. All 3 of them showed that people who ate more plants had less cancer by about 15 to 20%. Very consistent findings, whichever way you analyze the data. In myeloma, there have been a few studies looking at this specifically, and you can see here one study from the UK. This had very few number of myeloma patients, 65, because myeloma is rare, but the population was huge, 60,000 plus. And again, vegans, vegetarians had a lower risk of myeloma than meat eaters in this study. In the nurses' health professional study, people who had a higher inflammatory diet had a higher risk of myeloma. We published in the last year looking at 2 data sets. One is the NIH ARP, and this is the largest to date looking at population. And those who ate more plant foods had less myeloma compared to those who didn't. And the same thing we looked at in the NHANES study. And in this study, we basically looked for MGUS, the precursor to myeloma, and those who had more sugary drinks, and whether it was artificially sweetened or naturally sweetened, had a higher risk, like 40 to 60% increased odds of MGUS, and those who were eating fruits, vegetables, whole grains had a 40 to 60% lower risk of MGUS. Again, these are population studies. There are the issues around adjustment that we have to take into consideration, but if all studies are consistently showing us the same thing, there must be something there that we need to look into further, is how I see it. Dietary mechanisms for cancer risk reduction. So we published on this in terms of like how do plant foods reduce risk of cancer, and there are multiple mechanisms through the fiber. When fiber leads to anti-cancer, anti-inflammatory effects, phytochemicals or flavonoids, which are basically plant chemicals that have those effects too, and then optimizing weight, insulin resistance, insulin-like growth factor, the microbiome, inflammation, and then also these are different mechanisms. So we'll talk a little bit about each of those. And I'm not sure how many of you know about these guidelines, but these are guidelines from the World Cancer Research Fund and also the American Institute of Cancer Research. When we surveyed patients, less than a third knew about them, so really we're not doing a good job educating patients about it. But you can see out of these cancer prevention recommendations, 6 out of 10 are related to nutrition and diet. And these recommendations are based on thousands of articles. So there's an expert panel that puts together not just myeloma, but all cancers and all the dietary information, and says, what are the common themes we're seeing between all of this dietary research, and puts it together. And you can see that eating a diet rich in whole grains, vegetables, fruits, and beans is really very center here as well, and consistent with what we're seeing. Other things is limit consumption of red and processed meats, sugary foods, and then alcohol and fast foods and processed foods, of course. So now let's talk a little bit about the microbiome, and I know that can sometimes be a little more exciting. And I think this is a topic that you're going to see a lot more in the decades to come. We had genomics, then we had immune therapies, and then I think the next frontier is microbiome, is what you're going to see a lot more of over the next decade. And do we have more human or bacterial cells in our body? Because I'm asking, or because it's true. both ways, but basically we have about 30 trillion human cells and 38 trillion bacterial cells in us. So we're more bacteria than human. It's just that the bacterial cells are small, so you don't see them, and you see your human form, but you actually have more bacteria on you than human cells. And it is important because of this. We have to think about what the bacteria want to eat, not just what we want to eat, and that's why fiber is what's important here. So the microbiome in health and disease, when we think about microbiome for health and disease, when there's dysbiosis, there's going to be inflammation, and that inflammation can be more systemic too when the microbiome is perturbed. And there is data on how the microbiome is central to disease and health in many different ways. And one concept I want to bring up is the concept of microbiome diversity. So I'm not sure if you've heard about this before, but think about a rainforest versus a plantation. The rainforest obviously has many more species of bacteria, insects, animals, all of that, and even plants. But the plantation will have only one type of plant and maybe not that many different species. So what you really want is a rainforest of a microbiome. And that is called gut microbiome diversity, when there is this diversity of it. And within the microbiome space, there's a lot of debate on which bacteria are important or not. And I think we're just scratching the surface, and it is very difficult to know exactly, and that's a lot of research going into it. But one consistent theme in cancer that pops up, and you can see, is that microbiome diversity is associated with survival. And this, whichever cancer you look at, you see the same theme pop up. And it's like, anytime you read a microbiome paper, this is one of the things you'll see. And so this was from colleagues at MSK looking at transplant patients, and you can see that patients who had higher diversity actually had a longer survival post-transplant. I'm sure the next question you'll ask me is, how do we get a more diverse microbiome? And we can talk about many different things, but one of the things in terms of gut microbiome diversity was looking at a study which looked at over thousands of individuals who are healthy and asked them to fill out a dietary survey and said, based on their diets, who had more diversity versus less. And those who ate more plant foods, those who ate more than 30 plant foods per week compared to those who ate less than 10 plant foods, actually had more diversity and better microbiome health overall. But how do we define those 30 plant foods? Is it eating broccoli 30 times in a week? And I'm talking about 30 variety of plant foods each week. But how they defined it was, if you're eating carrots, potatoes, onions, that counts as 3 different plants. So if you make a soup with all of those, or you're eating a stew with it, you're getting 3 or 4 in that. So having the variety in what you eat is important in going out of the comfort zone, because each different food feeds different bacteria. Moving on to metabolic disorders like obesity and diabetes, they have been very clearly linked to an increased risk of cancer. And for obesity, it is 13 different cancers that have been linked, and myeloma is one of them. Diabetes, the data is a little bit less, and for myeloma, it's not as strong, but there is a link with diabetes and outcomes. We published recently looking at that with Mount Sinai, and we saw that patients who have diabetes have worse outcomes than patients who don't, and that's probably because the diabetes leads to the insulin resistance, inflammation, and the steroids and the difficulty handling treatment. So I think it's important to try to think about these diseases as things that we can manage or bring under control. It doesn't have to be that you have to have diabetes or elevated BMI or things. These are things that can be, over time, taken care of. I know that it's not easy for everybody, and I'm not saying that is, but I'm saying things that we could maybe think about how do we approach it and focus on them as well. Now moving to thinking about in the prevention space and some of the research we have done. is we looked at thinking about like pre-cancer states of monoclonal gammopathy to myeloma, smoldering myeloma, and then myeloma. We know that progressive genomic alterations, so genetic mutations, increase the risk, and as the disease progresses, there are more genetic changes. But we know there's also more immune dysfunction as the disease progresses. So it's a balance between the genes and the immune system that really keeps the cancer in check. And there are things, the modifiable risk factors that affect the immune system that could alter this risk of progression. That's kind of what we're trying to study and see with our nutrivention trials. And we'll show you some of that data next. So we do know, like I said, about elevated BMI and myeloma risk. Patients who have an elevated BMI and MGUS were twice as likely to progress to myeloma than if they had a normal weight, suggesting that there may be a link to the inflammation or things like that may be increasing the risk. And this was not just in one study, it was in 3 studies. I'm showing you 2 here with consistent findings. So with that, we started the nutrivention trial, and this was something I started about almost 5 years ago, the concept, and then we opened it to enrollment in 2021. The study finished in 22. 23 was when the patients all finished on the study. But what we did in the study was we enrolled patients with MGUS or smoldering myeloma, so the pre-cancer state. We gave them 3 months of a really high-fiber plant-based diet and 6 months of coaching, followed them for a year. We shipped them lunch and dinner for 3 months and provided guidance with a dietitian as well. And I'm just showing you the results from that, but we were able to see that we improved dietary adherence and quality of the diet. So you can see that to unprocessed plant foods, the dietary intake was about 20% before they went into the study. It was 92% on the study, and even 1 year out from the study, once we stopped giving them the food, it was still 60%. So really much higher than where they started out, suggesting that once people make these changes, see the benefits, it's possible to keep it going. We also saw an improvement in weight. Of course, these were patients with an elevated BMI, so it was about 7% reduction, and this maintained at a year out too. Quality of life improved too for patients, so they felt better on it as well. You can see here patients, things that improved for patients or how they felt. In green, you can see different things that subjectively patients reported they felt better with in terms of weight, hypertension, even sleep, energy. We had one patient who was able to stop insulin, one patient stopped medication for potassium, one stopped an antidepressant, so we were able to see some patients come off medications too. And all patients felt like this was something they could do, and some patients saved money because they were able to stop medications too. Other things, so we talked about insulin resistance. That is a state in diabetes, but also it can be present without diabetes too, where insulin levels would be a little higher in pre-diabetes or things like that. We did see that insulin levels came down in these patients. The microbiome diversity that we talked about improved, and it remained improved even at 1 year out. So we were able to see that improvement and maintain it. Also, we looked at inflammation. There were only 7 patients who had an elevated inflammation marker, C-reactive protein, but that came down and was about half at the end of the study compared to where they started. Cholesterol dropped by about 20 points, and we saw changes in the immune system too. In the interest of time, I'm not going to go into details, but it was more like an anti-inflammatory or quietened immune system. There were 2 patients on this study whose M spike was rising before they went on the study. So from 2016 to 2021 or so, their disease, as you can see in the blue lines, were 2 different patients whose disease was rising. So it had increased for one patient from 0.2 to 1.2. The M spike. And then on the study, it slowed down, and these are 2 which were statistically significant, so I'm showing you. Other patients may have had very small protein, so it's hard to see a change, or it may have been very stable disease, so we're not able to see a change. But these 2 patients that had rising disease, we were able to see a change. It's also important to know there were a few patients who didn't lose as much weight, didn't follow the diet as well, and their disease continued. It did not change, and it was rising as well through the study. So I think that, again, this is a very small study. This is very preliminary data, but it is encouraging to see that there is some ability to maybe potentially modify it. This was one of the patients on the study. Before the study, this is him and this is after. And he says that for him, this was, like he was on insulin for 30 years before he went on the study. He was able to come off insulin, and he's not needed it for a few years after now. And so it helped him basically live a more active life. He's in his 70s. You might think that he's younger, but in his 70s and able to do all of this. So it's never too late to think about these things. We also did a study in mice to look at can a high-fiber diet delay progression in mice. So mice studies are very controlled, and they allow us to look at one variable only and not anything else. So we gave half the mice, and this was in collaboration with Dr. Matteo Bellone in Italy, so his lab conducted these experiments. But we gave half the mice a controlled diet, meaning standard mouse diet, and we gave half of them high-fiber diet, meaning this was not like a Western diet or anything like that. It was standard mouse diet versus high-fiber mouse diet. And you can see that the number of mice that progressed in the standard diet, all the mice progressed to myeloma. In the high-fiber diet, half of the mice had not yet progressed at the end of the experiment. So with that, we're doing other studies. This is a decentralized study, meaning you can be in any state in the US and participate. In this study, a patient has to have smoldering myeloma. It's a very short study. We're trying to understand the microbiome in smoldering myeloma patients. And it's a 2-week study looking at different supplements and diet, and patients would get randomized. This is through the Health Tree Foundation. If you're interested in this study and you have smoldering myeloma, you can come talk to me after, but also you can sign up through their website. The Nutrivention 3 trial, this is a trial similar to the pilot study you saw. This study is enrolling at MSK, but also opening at Emory within the next week. And with this study, patients have to have MGUS or smoldering myeloma, so the precursor states, and we're looking at diet and supplements like curcumin and omega-3 and the effects on the microbiome and myeloma progression. Patients, we've had some patients fly in from other states too. If a patient is interested, they have to be able to come to New York or now Emory 5 times over the course of a year spread out. So if that's something that people are willing to travel, then that is potentially they can enroll, because the intervention, the diet, and all of that will be done locally. We don't have enough data in terms of whether diet can affect treatment outcomes at the same time as when you're getting treatment, and I think that that's an area that we need to study. There is a little bit of data in other cancers, but not in myeloma. What about in patients who've already had cancer and in survivorship states, so after? And you can think about it as, could lifestyle changes prolong the time in remission? And these are hard studies to do because you have to control for so many different things. But we have some glimmer of understanding where it may potentially help, right? So we're seeing here that microbiome diversity is associated with survival, suggesting that a healthy microbiome is associated with better survival. We published, Dr. Lisokin, Dr. McLachlan, and myself, looking at myeloma patients on lenalidomide maintenance, and what we saw is patients who have better microbiome diversity, better stool butyrate producers and butyrate concentration actually are more likely to be in sustained MRD negativity, or in 2 time points 1 year apart have MRD negativity, as you heard about that before, suggesting that the microbiome may influence it, but that's what we need to study better. We also looked at their diets, and we see an association. Again, this is a small study, but we're seeing associations where dietary flavonoids, which are plant chemicals, healthier proteins are associated with response. So we're trying to study how patterns of diet affect the microbiome and mechanisms which may affect myeloma control. We have this study also open and enrolling. This is almost finished enrolling, but we still have a little bit left. But these are new patients who go on maintenance. So this is a quality of life study looking at 2 different maintenance. For this study, people need to be coming into MSK at least once a month. And this is after their induction therapy when they're going on maintenance. And only 15 patients in each group are given the diet. So we're going to have that data hopefully in the next few years. So now moving on to just some practical tips or how do we think about it. These are just some practical tips. I've not had the time to go over why each one, like why whole grains are important and associated with reduced cancer risk, but just summarizing the important things that you could think about when you are. Prioritizing whole grains. Carbs are not bad, carbs are good. Whole refined grains are what we want, whole unrefined grains. We don't want the refined, processed, sugary carbohydrates as much as we can limit that. I understand we all enjoy that sometimes, and I'm not saying never, but I think just reducing it to much less if we can. Fiber, at least 30 grams a day. Prioritizing plant protein sources, beans, tofu, tempeh, if you can. Reducing red and processed meats. Fermented foods, very good for you if you like them. And then thinking about unsaturated fats, where you get them, nuts and seeds, if you can add a little bit every day to your diet. And thinking about how frozen fruits and vegetables are also equally healthy, if not more, than fresh. So if you say like, oh, I don't have access to produce, I don't have time to go to a grocery store every day, you can buy beans in a can, you can buy frozen fruits and vegetables and have that in your freezer. And even that one serving of it is equivalent, if not better, because when they pick the fruit and freeze it, it's right when all the vitamins and nutrients are ripe in it. So it's actually very healthy, even if you're eating it from a bag. So eating healthy doesn't have to be boring. It just needs some planning. And showing you pictures, because many times when people think about fiber-rich foods, plant-rich foods, they think salads, and they think that that's what they have to eat alone. But we're not talking only about salads. It can be cooked foods too, and there's a lot of things you can do. Just the same things you like, just if you like a burger, maybe think about a veggie patty instead of a hamburger. Small changes like that, if you can think about, those may go a long way. So many times when I talk about this, people think, oh, plant-based diet means you're saying vegan. Remember, vegan is not a diet, it is a lifestyle, and it is based from ethical and environmental reasons why somebody is doing this. And it doesn't have to be healthy, because you may eat Oreos and French fries all the time, and that's vegan still. Vegetarian often is from religious perspective, and remember, dairy is doesn't have fiber, and dairy is not plant-based. So even if somebody's vegetarian, but most of their diet's coming from dairy, they're not really plant-based. Same thing with eggs, right? So what we're talking about. And then high-fiber plant-based is where you're getting a lot of fiber-rich foods, and whether you are vegan, vegetarian, pescatarian, Mediterranean, paleo, low-carb, keto, whatever you call it, but you are getting most of your calories from fiber. And this is the food plate from the Canadian guide, actually, the food plate, and you can see half the plate is vegetables and fruit, a quarter is whole grains, a quarter is protein, but it is mostly plant protein, and this is actually from Canada's national guidelines, so it's not something making up. Few things we'll just talk about. I think we have a few more minutes left, so just maybe some trivia to wake everyone up if they were not listening. How much do Americans eat on average? And when you think about added sugar, could someone tell me how many teaspoons you think of sugar people are eating? In a day. So 10 to 30 is the range. I think y'all are pretty close. It's 17. So think about 17 teaspoons. That's what 50% of the population eats. You all want to be above average, right? So you want to get that number way below 17. And 6 to 9 is what the guidelines say. One can of Coke is going to give you 10 teaspoons already. Cereal often will have added sugar you don't know. So 4 grams is 1 teaspoon. When we think about fiber, how much do Americans eat on average? We kind of talked about this, and we said it's not a lot, but it's half of what we need. So 10 to 15 grams is what most get. What you really want is double that, and that's, so if you are at the average of fiber and you just add 1 cup of beans every day to your diet, you're going to meet the fiber requirements. So that's a quick way, because 1 cup of beans is 15 grams of fiber. When we think about salt, on average, Americans eat 3,400. You want it to be less than 2,300. But remember, most people, it's not the added salt on the table that's the main driver. It's the processed foods and things where you don't even realize there's salt in it, and it's coming in that. Fruits, 0.9 cups. Like I showed you, only 10% actually meet those guidelines. We want to actually double that. So if you eat one banana, you're getting close to your daily intake. Same thing for vegetables. It's about half what you really want. And then what about protein? Do you think Americans are getting enough protein? No? No would go with the theme, right? They're not getting enough of anything. But actually, we're getting too much of protein. We get double what is the requirement. I'm not saying that every person we have to match the exact RDA, but 80 to 100 grams is what Americans eat on average, and what is the actual recommended is about 48 to 72, and 72 is on the higher end too. If you think about 0.8 grams per kilo is the RDA, but if we say we need it higher for older people, patients with cancer, things like that, maybe it's 1 to 1.2 grams per day. That would be 72 grams for a 60 kilo person. So we really want to think about it that way. And still we just focus on protein. I see it all the time. It's like, oh, I'm not getting enough protein. But think about the other things. It's more likely you're not getting enough fiber. So recently, I came back from Peru, and Yelak told me I should put in this picture and talk about it, so I added this yesterday. But what does facing cancer have in common with climbing a mountain? My experience with going through Hodgkin's 8 years ago, lymphoma, and then going to Peru with 8 other women myeloma doctors, recently, and so I think I've seen both sides, and I'm asking you, do you think there's anything in common with that? In some ways, no, but in some ways, yes. We are putting our bodies through hard challenges, and we want to be our fittest as we face them. So, and going through both of them, I will say going through cancer is much harder than climbing a mountain. So if you are able to go through that successfully, then you are able to do a lot of things, and you have more potential than you believe you do. So it's important to think about how do we optimize our health beyond just thinking about, okay, I need to get the treatments, but there's lots beyond and around that you want to do, exercising, eating better. And sometimes it's hard. It's hard because we live in a society that it's not easy. You have to think about it. You have to plan. But if you make it part of your habit, then it becomes easy. So the initial part takes time. So these were the 8 women doctors. We just came back in July, and we climbed to 17,000 feet. So when I did this, actually, because of my chemotherapy, I had gotten bleomycin, which is a drug that affects the lungs. So my last dose of that chemotherapy was held because I had some lung toxicity. And so before I went, I actually got pulmonary function tests to make sure that my lungs were fine, because I knew this would be a problem there. Luckily it was, but again, those are things we do all the time, right? Like we optimize our health with those things, but that's not enough. Like we have to do the other side too, which is what we're talking about here. So my Peru hike was 100% fiber fueled, and it was still successful, so I had lovely colors of food and great things to eat. So think about some goals you want to pick, at least pick one to begin with, whether it doesn't have to be everything together, but just think about one thing that you will do, and then slowly you can add them to it. So I think when we think about future directions, we want to do more of these interventional studies, and I think obviously getting funding to do these kind of studies takes time, but hopefully we will. So let's change our focus from living longer to living better and longer, and incorporating lifestyle into our life. So with that, I'd really like to thank the IMF. Thank you all for listening, and patients who've taken part as well. Thank you. And I do post a little bit on social media. It's Urvi Shah MD, but you can get a lot of the information on talks that I've given also through IMF on their webinars as well. And we're going to be doing a Facebook Live, I think, later this month.